that it is a most difficult issue and one that challenges each and every one of us. And no political party is immune from that. I want to refute the spurious accusations that people who have come onto the streets in the wake of this tragedy are opportunists. The same accusation has been made against Sinn Féin in relation to this motion. And I think it is a most insensitive accusation. There is no party political advantage in this for any political party represented in this House. And there is certainly none in it for Sinn Féin. The facts will demonstrate that far from it is the truth. The opportunist approach, however, in terms of seeking party political advantage, would be to try to avoid the issue as much as possible. And there is ample evidence of this across this chamber and in the utterances and media performances of some beyond these walls. But we have not done so. In fact, we have long had a policy which calls for what this motion seeks. And that is the introduction of legislation to give effect to the 1992 judgment of the Supreme Court in the X case, to protect pregnant women where their lives are in real danger, and to give legal certainty to medical professionals. To restate Sinn Féin's position for the sake of clarity, Sinn Féin is not in favour of abortion. We believe all possible means of education and support services should be in place. However, in cases of rape or incest, or where a woman's life or mental health are at risk or in grave danger, Sinn Féin argues that the final decision should rest with the woman concerned. That said, not all Sinn Féin members concur with that policy. That is a most contentious issue, with widely differing and strongly and sincerely held views in all political parties. So let us be mature and honest and acknowledge that to each other. It has cut across Irish society in a very divisive way on many occasions. That could be and has been used by political parties and legislators as an excuse for inaction. But it was never, and it is certainly not now, an acceptable reason for doing nothing. During the course of the debate this evening and last evening, a number of what I would regard as swipes were made at Sinn Féin. And I can understand the motivation behind these. After all, if you are being whipped to vote against a motion that you yourself strongly support, you will want to strike out at someone. So it was with respect to Deputy Ciara Conway last evening and the remarks that she put on the record. She conveniently forgot to mention that the Sinn Féin members in the Dáil last April voted for X-case-focused legislation to be processed beyond second stage when she and the Labour Party voted against it. Our position on abortion in the 6 counties has also been misrepresented. Sinn Féin does not support the extension of the 1967 Abortion Act to the north. We say that what is now required is clear and robust guidance which protects the life of the mother. And that position is in line with our party policy on an all-Ireland basis and is in line with this motion before this House this evening. There is no difference in our policy, north and south, as some have tried to claim. And others, of course, have been galloping across the media, anxious to be seen, if not heard, talking themselves into knots as they endeavour to avoid the issue. I believe that the tragic death of Civita, Halappanavar, and the discussion which has followed has opened the eyes of many people to the dangerous reality that the ambiguity in our laws has created. It was for this reason, and this reason alone, that Sinn Féin brought forward our private members' motion. The Dáil needs to reflect in a timely manner the concerns of those who elect us and to address the pressing issues that we as legislators are elected to address. The motion seeks an acknowledgement of realities. It asks the Dáil to acknowledge the reality that the absence of the required legislation denies women protection and the right to obtain a termination in life-threatening circumstances. It asks the Dáil to acknowledge also that the lack of legislation creates an ambiguous legal situation for clinicians. Can anyone here deny, as the motion states, that it is regrettable that successive governments and ministers for health have failed to legislate? That, at least, is something that I, a new minister, will agree upon. We do need immediate action. We have waited too long and have not received even an indication or a signal that the government will legislate. And I repeat, will legislate. That intention should be made clear by government now, here, tonight. The government's failure to give that commitment is very worrying. So too, might I add, was Minister of State Kathleen Lynch's exhortation last evening that we, and I quote, let wiser heads prevail. Is that how she and her Labour Party fellow ministers in government justified their decision to back James Riley when their and your party colleague sacrificed herself on the pyre of accountability and standards in ministerial office? Wiser heads, how are you? You know, it's tantamount to saying, leave it to your betters. Well, I have to say I'm surprised at Kathleen Lynch, and I have to say that I never thought I'd hear such rubbish from her here in this chamber. The government amendment, Minister, and face up to it, fails to give the required commitment and is accordingly deficient, and we cannot accept it. The report of the expert group should be published. Let the legislators and the public see it and judge for themselves. There is no reason, Minister of State, why that report should not be published immediately. The Cabinet is wrong, in my view, to suppress it for another week in order to shield itself from public scrutiny. Its deliberations on the report are covered by Cabinet confidentiality, but in the meantime, we all have a right to know the subject of those deliberations, and that is the least that we are entitled to. It is most regrettable that an issue of trust and credibility arose about the HSE inquiry almost as soon as it was established. I do not question the credibility or integrity of any of those named on the initial inquiry panel. However, the now reversed decision to include 3 consultants from Galway University Hospital left the process open to doubt from day one. Over and above that consideration, there is a need for an independent public inquiry separate from the HSE investigation. Civita's family have expressed their lack of faith in the HSE inquiry. They have made the very valid point that if they had not spoken out, and if there had not been a public outcry, then even the HSE inquiry would not have been established. And I think we all know that. If it turns out, as it very definitely appears this evening, that the HSE inquiry does not have the cooperation of the family of Civita and access to her medical records, then it will be simply untenable, and if it proceeds on that basis, it would have no credibility whatsoever. One thing is certain, a way must be found to ascertain the facts speedily and with the full cooperation of Savita's husband and family, and with fairness for all concerned. Fairness for Savita, for Praveen, for the family, fairness for the hospital staff, and fairness for all pregnant women who use our healthcare system. There must be an independent public inquiry, and it must be fully transparent, and we need that decision now. It has to be stressed that the experience of the vast majority of pregnant women in our healthcare system is positive, and that this state is predominantly a safe place to give birth. No one who is calling for legal change denies that. However, the sad reality is that the legal ambiguity around this issue creates an area of danger to the lives of pregnant women, and that danger, no matter how small the number of women who may encounter it, must be removed once and for all. During the course of the Dáil debate on the Private Members Bill to legislate in line with the X case judgment last April, Health Minister James Riley stated, and I quote, "I wish to meet our obligations, not simply to the European Union, but more importantly to our citizens. The government will take the correct action based on the best advice available to it to ensure no woman's life is ever put in danger." That was last April. It is awful to contemplate that it has indeed taken the death of a young woman in tragic circumstances to bring this issue back onto the political agenda. There is no excuse for delay. We have had 20 years of delay and prevarication, and the issue can no longer be avoided. Ideally, we should all move forward together towards the legislation required. This should not be an issue of party political contention and conflict. We had more than enough of that in the past. We should certainly seek the maximum possible consensus in this Oireachtas and outside it, but ultimately it is the responsibility of government to government, and that is what the motion before us asks this government to do. In conclusion, Count Corlea, let me restate that the Sinn Féin motion is not about abortion. We are not a pro-abortion party, and I'm not a pro-abortion deputy. This motion is about protecting the life of pregnant women when that life is in real danger. It also seeks to give legal certainty to medical professionals. As a husband and a father of young daughters, I do not want my loved ones to ever have to face what Savita Halappanavar has had to face, or pay the tragic price that she has had to pay for the failure of successive governments to act. Sinn Féin has brought forward this Dáil motion and has encouraged, in a measured and reasoned way, its acceptance. And most importantly of all, we have encouraged this government to act and to fulfil its promises and responsibilities so that the appalling tragedy of the death of Savita will never happen again. I urge all deputies in this House to support the motion now before you.
Thank you, Deputy. I now put the amendment number 3, in the name of the Minister for Health. The question is that the amendment be made. The